Guys, welcome to my YouTube channel, Learn Nursing with Diljot. It's our day 1 of A to Z Pharmacology Challenge. So, today is our day 1 with a letter A. A for antibiotics. So, let's move on. Antibiotics are the drugs that work against bacteria. Mechanism of action: it inhibits protein wall synthesis by bacteria that includes MAT, macrolides, aminoglycosides, and tetracycline. Secondly, it inhibits bacterial cell wall synthesis, that is by cephalosporins, carbapenems, penicillin. Thirdly, it inhibits polyate synthesis, that is by sulfonamides. And lastly, antibiotics inhibits DNA replication, example is fluoroquinolones. Next are types of antibiotics. Firstly, sulfonamides, quinolones, fluoroquinolones, beta-lactam antibiotics, broad-spectrum antibiotics, aminoglycosides, macrolides, miscellaneous antibiotics. Now we will discuss about sulfonamides. Examples are sulfadiazine, sulfasalazine, silver sulfadiazine, mifenide. Points to be remembered: mostly sulfonamide starts with sulfa. Secondly, before administering sulfonamides, ask for sulfa allergy to the patient. Take folic acid when we take sulfonamides. Increase fluid intake, as sulfonamides can cause sunburn, so wear sun protective factors or avoid direct sunlight exposure. Next, we learn about quinolones. Quinolones were fluorinated to get fluoroquinolones with wider spectrum of antibiotic, less side effects, better tissue perfusion, and lesser chances of resistance. Thirdly, we will learn about fluoroquinolones. Examples are norfloxacin, levofloxacin, ciprofloxacin. Here are some points to be remembered. Mostly fluoroquinolones ends with floxins, as it causes sunburn, so avoid direct sunlight, prolonged sun exposure, wear sun protecting factors, and report any new pain, especially in the Achilles tendon. Give in question with patient having kidney impairment. Fourthly, we learn about beta-lactam antibiotics. Beta-lactam antibiotics have beta-lactam ring on them. They are divided into 4 categories. Firstly, penicillin. Secondly, cephalosporins. Third, monobactam. Fourthly, carbapenem. And now we will discuss them in some details. Firstly, penicillin. Penicillin have 2 forms, natural and synthetics. Natural penicillin examples are penicillin G, procaine penicillin, benzathine penicillin. Synthetic penicillins are penicillin V, methicillin, ampicillin, amoxicillin, and piperacillin. Points to be remembered: mostly penicillin ends with cillin. Always take penicillin with food because it may cause GI disturbances. Done sensitivity test prior to penicillin administration. In penicillin reaction, that is severe reaction caused by penicillin administration, firstly stop the penicillin. Secondly, you have epinephrine injection on bedside. Thirdly, notify HCP, healthcare provider. So we discuss about cephalosporins. They were divided into 5 generations. First generation includes cefazolin and many more drugs, but we discuss 1 or 2 drugs in each generation. So next generation includes cefuroxime. Third generation includes ceftriaxone, cefoperazone. Fourth generation includes cefepime. Fifth generation includes ceftaroline. And cephalosporin starts with CEF. Next, third class is monobactam. Monobactam have 1 lactin ring on them. Example is aztreonam. Fourth, we discuss about carbapenem. They include meropenem, imipenem, ferropenem, and the ends with penem, EM. Next, we have broad-spectrum antibiotics that were divided into two categories, chloramphenicol and tetracycline. Chloramphenicals were given in bacterial meningitis and typhoid fever and many more diseases. Secondly, we have tetracycline that have four cyclic rings on them. Examples are tetracycline, chlortetracycline, doxycycline, methylcycline. Here are some points to be remembered for tetracycline. First, tetracycline ends with word cycline. Secondly, they are not pregnancy safe as they may cause congenital abnormalities to the fetus. They cause tooth discoloration, especially doxycycline, if given to the pregnant woman or or a child having milk teeth. They may cause permanent staining of teeth. Secondly, they cause sunburn. Avoid calcium products when you take tetracycline. Take tetracycline on empty stomach. Do not lay down after taking medicine, so sit up for at least 30 minutes. To prevent GI disturbances, sixth class is aminoglycosides. Aminoglycosides have amino sugars in glycosidic linkage. They are not absorbed orally, so given via other parenteral route. Examples are streptomycin, tobramycin, gentamicin, neomycin, amikacin. Mostly ends with the word mycin. So here we are. Gentamicin and neomycins are very toxic antibiotics. Basically, gentamicin and neomycin are nephrotoxic and ototoxic. So obtain baseline renal function test and hearing test before administering aminoglycosides to the patient. Seventh class, we have macrolides. Examples are erythromycin, clarithromycin, azithromycin, roxithromycin. They end with the word thromycin. They are hepatotoxic, so obtain baseline hepatic function that are liver function test. Secondly, they prolongs QT interval on ECG, so obtain baseline ECG before administering macrolides. Last class, we have miscellaneous antibiotics. They include spectinomycin, clindamycin, mupirocin, teicoplanin, colistin, polymyxin, linezolid, and vancomycin. Vancomycin is important drug to us. Vancomycin is nephrotoxic, ototoxic, so obtain baseline renal function test and hearing test before administering vancomycin. Classic symptom of vancomycin is red man syndrome. If given very rapidly, it can cause severe hypotension, flushing, pruritic rashes to the patient. Red rash appears on face, neck, chest and extremities of the patient. Lastly, we have some important points of antibiotics. Take all the medicine until finished. Do not stop when you feel better. Avoid alcohol when you take antibiotics as its effect may be decreased. Most important thing is oral contraceptives are ineffective when we take them along antibiotics. So use another method of contraception. And lastly, avoid direct sunlight exposures in some antibiotics like fluoroquinolones and sulfonamide. So that's it for today. Thank you for watching, guys. If you like the video, please do like, share, subscribe and also comment below.